This year we've invested more in the development of our maternity services and in women's healthcare in general than ever before in a single year. Budget 2021 saw increased allocations of development funding for maternity and gynaecology services to the tune of €12 million. The funding allocated specifically to the National Maternity Strategy is €7.3 million. That's the biggest investment in the strategy since it was launched, and to put it in context, it's a one-year increase in the strategy of around 500%. This will significantly enhance our ability to deliver on its vision and to improve the experiences of women and families accessing maternity care. Specifically, the funding provided this year will help underpin the further development of community midwifery as well as specialist services. In addition to this, €5 million has been allocated to the Women's Health Fund. A number of significant initiatives in relation to gynaecology services are also being advanced. These include establishing or expanding services across 9 see and treat ambulatory gynaecology clinics in 2021 and additional fertility hubs. We're establishing and expanding services across 9 clinics in Dublin, Drogheda, Waterford, Wexford, Letterkenny, Kerry, Mayo and Portlaoise. We're establishing 2 new regional fertility hubs in Nina General Hospital in Galway this year, bringing the total to 6. I recently announced the expansion of the endometriosis service at Tallaght. This service will help to deliver a much-needed specialist centre for the management and treatment of all forms of endometriosis, with a particular focus on advanced and complex cases for which there has been no ready access in Ireland. I was delighted to receive a proposal from the Irish College of General Practitioners for a clinical general practice lead for women's health, and recently announced funding for this position. This will enable the development of a range of new educational and support services for GPs to enhance women's health services in their practices. I also recently announced further funding to the HSE of approximately €1.6 million to fund 24 additional lactation consultants, providing increased breastfeeding supports to every maternity unit in the country. My department is progressing a range of actions on menopause. Initiatives that are being advanced include a menopause workplace policy, provision of specialist support in the area of menopause, and a health awareness campaign to increase visibility of and awareness of menopause. And I think there's a lot more work can be done in that area. The Government is committed to the development of a new national maternity hospital on the St Vincent's campus. The project is unprecedented and complex. We're relocating one voluntary hospital to the campus of another voluntary hospital and into a hospital building owned by the state. A legal framework is being developed to protect the state's investment in the new hospital and ensure it remains in state ownership. The legal framework will also ensure that health services at the new hospital will be provided without religious, ethnic or other distinction. And I know I'm out of time, Chair, so if you bear with me for just a few seconds, I'd like to state here again categorically something that I stated at the Health Committee and something that I stated again yesterday when I met the National Women's Council and others who've been involved in campaigning for these services. I will not countenance any new maternity hospital that has any governance or influence whatsoever that involves any religious ethos whatsoever. That is an absolute commitment. Services will be provided in accordance with the law and in accordance with national policy, and that's it.